already, that doesn't mean that they're going to be, it's going to be a negative answer for the rest. It's going to be, each person needs time, and I like to give them that time and have the opportunity to answer their unique questions.
And just a quick follow-up for you, just in the clinical expertise of infectious disease. Have you been surprised recently, or certainly throughout the course of this pandemic, with how sick various patients have been? That, you know, in medicine, we expect certainly certain people who are high risk to begin with, but what has surprised you about some of the way this virus really attacks and affects people who maybe didn't come to your hospital or your clinic with any pre-existing medical conditions, or weren't high risk until they became really sick with COVID?
Yes, back last year in April, when everything started, and as you know, in New York, we were hit very bad. The patients that I saw the most in my hospital were patients that are coming from backgrounds that are common with my background. They're Latin Americans, they're Hispanics, and I saw this population getting extremely sick without necessarily a lot of medical underlying conditions. I remember very well patients young, that they were just working class patients, less than 40 years old, and being in the ICU, intubated with full oxygen support and mechanical ventilation. It was really hard because in many of those cases, I was the person speaking in Spanish to their family members. And how do you explain to their parents that their young son is in that status, and that it's very unlikely that things would look positive after the hospital admission? So it was very shocking to see healthy people being admitted to the hospital with severe illness. And this continues to happen in the setting of Delta. Delta has been a very bad actor, has been showing up with very bad profiles, and we see young people, pregnant women, getting in the hospital in situations that we will hate to see anyway.
Heidi Arthur, I want to bring you in, Chief Campaign Development Officer for the Ad Council, and I want to ask you about something that is squarely within your wheelhouse, the communication and confusion in terms of the messaging about the vaccine. It's evolving, it changes seemingly by the day. People have what I like to refer to as medical headline whiplash. Can you speak a little bit about the importance of messaging and communication, and how you think it has been to walk that fine line between keeping people informed and understanding that we still don't know everything about this virus and the vaccines?
Yes, first, I want to say thank you so much for having us here today for such an important conversation. And I think, you know, we learned very early on from day one that we were going to have to cut through a lot of confusion, a lot of information that was changing very rapidly. And what we learned that, you know, we needed to communicate and honor was having empathy and understanding that people have questions, and honoring the fact that it is overwhelming and a big decision for many people to make. So we had to ensure that we were listening to our different target audiences, understanding that it's not a one-size-fits-all message, because certain barriers are different for certain communities for very good reason. And having, you know, trusted voices at the forefront was essential to communicating very effectively. And for many, that's a healthcare provider. For parents, it's a pediatrician. For other people, it could be a faith leader. For young adults, it's family and friends. So ensuring that it's trusted messengers and that the messages are really in keeping with where people are on their own personal journey, and that we're closing the gap in terms of combating misinformation with credible information from trusted resources at every point along the way.
Yeah, I want to hear from Mata and Rita on that, because I think that what you mentioned, Heidi, which is so important and in my opinion has been missing in this, certainly since we've had a vaccine and now 3 vaccines, which is going on since December of last year, is people who have not been vaccinated have been vilified, which is something that when you're dealing in public health and clinical medicine and you counsel patients on behaviors on a regular basis, as my colleagues on this panel and I do on a regular basis, that discussion starts with respect and the principle in biomedical ethics of patient autonomy. And it's our job to counsel with correct, factual, scientific information, but it starts and ends with a respect for that person and their autonomy. So, Dr. Minguez, speak to what you've seen up in Washington Heights and your communities in the Bronx, New York Presbyterian, Columbia Medical Center, my alma mater, and in particular, the adolescent and pediatric population that you specialize in, and how this dialogue has evolved, in your opinion.
Thank you so much for having me. And yes, this is really an important question, because when you are dealing as a pediatrician with a parent and the patient, when you're thinking of messaging, it's really key to speak to both. There's a dyad that you're speaking to. And also when you speak to the parent, it's important to give them the tools to have that conversation, because you mentioned something key, and that is autonomy. And that adolescent next to the parent also has autonomy that we have to validate. And I have to tell you about an experience in which I was talking to the mother for quite some time to try to discuss and make her aware of the scientific side of the vaccine. And she was not budging. She was definitely hesitant about it. And I looked at the patient and said, hey, what do you think? Why don't we talk about what you feel about the vaccine and your knowledge? And to tell you the truth, it only took that adolescent to have that conversation with the parent for the mother to say, hey, if that is what you want, I'm here for you. So please, I would say to everyone to ensure to talk to the patient, but if that patient is a child or an adolescent, to ensure that you also give that person, that patient, autonomy.
I'm so happy you shared that. And I take care of a lot of teenager patients as well, but as a mom, that really resonated with me. Sometimes we don't give our kids as much credit as definitely they deserve. Rita, speak about the underserved communities and not just the impact of COVID and this pandemic, but in particular, the vaccine. Where are we now, and how much work is there to do that you are working on?
Dr. Jen, thanks for having us, and with such a great, prestigious panel of female leaders in the country. And I just want to say that, to come back a little bit about what you mentioned earlier on respect. It's part of our values as Unidos US. We're the largest Latino civil rights and advocacy organization in the country. We have more than 300 community-based organizations as our affiliates, and community health centers that we work with. So also as a mother, the respect, the ganas, the compassion, the listening, the opportunity for us to be able to be present in the moment is super important. And I think early on, for a lot of our affiliates, which are many of them have promotoras de salud or community health workers, they had a lot of questions. They were hearing a lot of rumors. We weren't getting all the information in the language that we're most comfortable with. And so they came to us, and we actually reached out to them as well. This is, what is it that you need? How can we be able to ensure that we have language in the language and in the places where you need it the most, so then that a lot of the misinformation doesn't get pushed out and then spread out. I think that's just super important. I think we have, as I think everybody knows in this room and out in the community, especially the Latino community, that we've been hit significantly. We've suffered that not only economically, but also physically, and I want to say mentally. As a Latina mom, it's very difficult to be able to know that your child is still not protected. I have a 9-year-old son, he's back in school, and that's, really hard for many of us, that we know that this is important for them to be in the classroom to learn, and not to be, isolated, at home. So there's a lot of, challenges that we have, but, we have made significant progress over the last couple of months. We're 2 times, 3 times more likely to get diagnosed with COVID. We had, a recent survey with Latino parents, and they felt more than last year at this time, that this pandemic is not over. And the reason for that is because of their own personal experience. They have seen family members die. They themselves have also have gotten COVID, and they have suffered from both the physical and the health reasons. So a lot of the work that we've been doing on Esperanza Hope for All campaign, and the work that we've been partnering with the Ad Council, is really trying to make sure that we're getting the message out there in language, and saying, it's okay. It's okay to have questions. There's so much information out there. And, I really enjoyed your conversation with Dr. Fauci this afternoon, because, it's trying to figure out, are we calling this a booster, or are we calling this a 3rd dose? We don't know this. And I think this is the element that it's important to be able to recognize the space that we're all in, and that we all need to be patient, but at the same time, our lives are at stake. So I think that's critical.
You mentioned, Rita, psychologically difficult, the social impacts of this pandemic and this confusion. I would like to go through for the rest of the panelists and get your thoughts on that, because, I like to say in medicine, we really treat the whole body. We should be treating the whole body. There's usually a head connected to a body. And when we could be focused on a body part, we always have to remember the spirit and the mind and psyche and psychology involved. So Dr. Kottkamp, why don't you start and just talk about that a little bit for people who are watching and listening now and feeling this relentless anxiety and stress and confusion and uncertainty, what you think they can do about it, and what impact you've seen it have on your patients.
Yes, definitely. We have seen that a lot, not only among patients, but also between us, right? We are the providers. We are here for the patients always. And the pandemic has been extremely hard in all of us, the communities, and also in the healthcare workers. I think that none of us were expecting that the pandemic was going to last this long. I remember myself telling my patients, okay, we're going to have the next time a televisit, but then maybe in 6 months we'll see each other and everything is going to be back to normal. And now look, we are like near 2 years on this, and it's taking a big toll in all of us. I think moving forward, we need to be supportive of each other. We need to be gentle. We need to be have empathy and respect for the work that we do, and respect for what people have gone through. Many patients have lost many family members. I am aware of families that lost kids, that lost both of their parents, or a big number of family members. And so it's a tough time, and we are all on this. I think we just need to be very care about each other, and be very, very gentle about how we interact and how we treat each other, because we are all going through the same pandemic.
And I think that's so well said. Heidi, what's your opinion about the psychological stress and anxiety that people are feeling? And does it make communicating about the importance of the vaccines and the latest in this pandemic more challenging?
It does, because people are exhausted. I mean, they're fatigued with all of the messaging. And, for us, it means really staying on top of what's the most important thing on people's minds, so that we can really address it head on and help allay concerns, or acknowledge where the concerns are, and provide access to resource and information. And I would also say just dealing directly with overall mental health and wellness is so important now for families. And there are things that people can look to and resources for people to understand how to check in with their kids to make sure that, you're moving beyond it's okay or I'm okay. And, for young adults to understand the importance of checking in with each other and talking about it. So all of this is so critical and overwhelming, but definitely has to be considered as we message.
You're so right. Critical and oftentimes seemingly overwhelming. Mara, Dr. Minguez, you're, again, pediatric adolescent specialist. I'm the mother of 2 college-age, they'll always be our babies, children, young adults. I've seen the stress of this pandemic on them. And I shared publicly my daughter who's in college, Chloe, fully vaccinated, of course, had a breakthrough case of COVID that was picked up at her college. They were doing surveillance testing several times a week. And she tested positive, it was confirmed, and she had to go into 10 days of course, isolation. Minimal symptoms was the good news because of the vaccine, thankfully, but the psychological impact of that isolation was way more difficult than the physical manifestations. So what are you seeing in the adolescent and college age group, and how can parents help our children through that? Because that, I think, can be as hard, if not harder, than the infection itself.
Absolutely. And thank you for talking about that, because when we talk about kids and adolescents, we don't really, think about the well-being as a symptom, right? We always talk about the physical manifestations of COVID, but really do not focus on how the mental health aspect of it in our kids and young adults. They're with us. They're experiencing everything that we're experiencing. They're experiencing great disruption. They're also experiencing loss. Many adults have died, but many of those adults had kids in their lives that have now experience that loss. So thank you for that, because it's important, and their development is important. Socialization as part of their development is key to continue in-person learning. The educational outcomes that are going to also be a consequence of the disruption, it's something that we're going to have to think about and worry about in the future. And what I would tell parents is, just like Heidi mentioned, which was beautifully said, is communication. Talk about it, engage in conversation about how they feel. And we are also concerned with our own worries that sometimes we may forget to do that. So I would definitely say to any parent out there who has not asked your child how they're doing in terms of COVID, please, use tonight at dinner for that conversation, because it's key.
Oh, that is such good advice. Great topic. Specifically pointed question to ask tonight around the dinner table. Rita, are we making progress in getting people in underserved communities who already at baseline may have difficulty with accessing the healthcare system in terms of testing or vaccination or even just education? Are we making progress? And what can people listening to this, if they are in an underserved community, either geographically or in any other way, what can they do to get vaccinated or get tested, if anything?
So I would say, yes, we're making significant progress. And just in the work that we've been looking at for the Latino community, even the last couple of months, we've seen a significant amount of folks wanting to get vaccinated. And I think the element here is we're trying to reduce a lot of the barriers. So we're working with both private companies as well as the federal government to relieve those barriers. So what I'm talking about is transportation, ensuring that folks have transportation to go to get a vaccine, information in language, recognizing that 70% of Latinos speak another language, and that we have this information in the language that they're most comfortable in speaking and reading, and then I think the other thing also is that we have a collaborative a cooperative agreement with the Centers for Disease Control, where we're working with 33 community-based organizations and community health centers to do vaccination events. So these are working with community health centers who are safety net providers in medically underserved communities. So then that the time and the effort to be able to have promotoras, who are trusted messengers, for them to be able to access the vaccines and also to inform them that they're free. I think the other thing that we saw really early on is that many were turned away because they were asked for Social Security numbers or different documentations and made it difficult. I think we had really good opportunity to work with our retail centers to be able to say, listen, this can't happen. We're in the middle of a pandemic. We need to make sure that people have access to this information, to the vaccines right there. And so we have pop-up sites. This weekend, we're doing a mobile tour. We've been doing it part of a series of mobile tours, going to bodegas, going to flea markets, going to grocery stores where most Latinos go to, for us to be able to inform them and saying, okay, here's how you go about in getting it, and having a place for them to talk with and answer their questions, because I think people still have questions. The one thing in our survey that we had with Latino parents recently was that majority of the Latino parents were more likely to vaccinate their eligible children. That's significant. And they were more likely to also be open to having mandates in the schools or in restaurants or in areas, because they really felt that 9 in 10 of these Latino parents were very worried about their children under the age of 12 becoming seriously ill. And we heard the long-term effects that something like this can happen. So I think it is being in community, making significant progress. There are continuing to be barriers like time off from employers, allowing individuals to be able to go and get a vaccine, and or if you do have symptoms after the vaccine, a time off to be able to recover from that. So I think there's a lot of work that we have accomplished, but there's a lot more work for us to be done, especially with the Delta variant.
I agree with that. I want to get to our viewer questions. We have some great ones here. And I would actually like, if the panelists, if you're all up for this, to hear quickly from whoever wants to answer. I want this to be a little looser and more organic. So for the first question from Paula, who's from Queens, New York, she asks, for people who missed the second dose for circumstances beyond their control, can they still take that second dose if the first dose was taken 6 months or so before? And if so, do we know how effective it will be so many months after the first dose? So basically, if you're out of that 3 or 4 week regimen time window, what should they do? And I guess I said I wasn't going to ask, but I guess we should start with our infectious disease expert, Dr. Kottkamp. You want to take this one?
Sure. Paula, thank you for the question. It's somehow a common situation that some people find themselves in the circumstances that you are. And so I think that 6 months, it's a very big gap between the 2 doses based on what we know of the vaccines with the data that is available. I definitely recommend you to get your vaccine as soon as you can. We're seeing what's going on with Delta, and this is something that we cannot take lightly. So please get your vaccine again. I think because 6 months is a big gap potentially for you, the best option will be to just redo this schedule again. So if you're going to go with one of the 3 available vaccines, just make sure you get the full schedule, if it's a 2 dose or if it's a 1 dose. But it's a big gap, and we don't have enough data in that particular scenario. But I feel that you should be fine after the 2 doses.
Anyone else want to throw anything in on that one? Okay. So second question is from Nancy from Brick, New Jersey, who says, I'm 75 and I have some health issues, but I got the Moderna shot, and the only one that seemed to be approved and available is now the Pfizer shot. I guess she's talking about a booster. Can you get this one, or do you have to wait until the Moderna one is approved? So I'm going to assume that Nancy is really asking now about what I spoke to Dr. Fauci about, the so-called mix and match regimen. Mara, do you want to take that one?
Sure. And I would have to echo what he mentioned in terms of the data not being fully available for that purpose. Absolutely. But one of the things that I would suggest is actually, if they have the ability to get it, to do so. But again, one of the things that's really key, and I always mention in any panel or any conversation, is that these conversations actually are a supplement to the conversation with your provider, because they know you better than anyone. So this is a supplement, and it's really key to sit down and talk about the time frame and your vulnerability and how important it is for you to get it at this time. So definitely do that. But as Dr. Fauci mentioned, data is not fully available and the studies are ongoing.
We've gotten a lot of questions about the vaccine during pregnancy. And so that is my medical specialty. I'm going to start with the answer, but then I would really like to hear from all of you your views about this particularly vulnerable population, which is pregnant women. Now we have, which is pretty rare in medicine and science, but we do have uniform consensus and support from the CDC, the FDA, ACOG, which is the American College of OBGYNs, and the Society for Maternal Fetal Medicine, recommending and supporting this COVID-19 vaccine in all trimesters of pregnancy for women who are considering pregnancy and or women who are breastfeeding. Why that is finally the case and there's uniform consensus is because we have data on tens of thousands of women who were vaccinated during their pregnancies. There were no significant safety signals. So that's on one good side of this science in terms of the support and the data. On the other side is the risk. And I know that Dr. Kottkamp, you can speak to this. Dr. Minguez, you can speak to this. And I know Heidi and Rita, this is very much on your radar as well. We know that pregnant women are an incredibly vulnerable, high-risk population, not only to this virus and upper respiratory infection, but to influenza as well. I've mentioned myself on the air multiple times that as a practicing OBGYN, the only patient I ever had die was a 16-year-old Hispanic teenager who was pregnant and died of influenza. So I take this very, very seriously. So we have the known risks of COVID to the pregnant woman and her fetus, and as well as her newborn. And we have the safety profile. And that's why you have all of these professional organizations recommending this. But can we all go through the messaging and the science and the counseling to this population, not just to pregnant women, of course, but to anyone who knows a pregnant woman who cares about this? Rita, do you want to go first, actually?
Sure. This is very personal in so many different ways because it's actually one of the number one question we get from many Latinas is, will this vaccine affect my baby? And oftentimes, it's often influenced also by their partner too. And the spread of information or misinformation that they're hearing. So being able to, number one, have clear information and actually working with influencers like we have done to be able to answer these questions are super important. And having that information, and also to make sure that they are also talking to their providers, to their OBGYN doctors, and being able to ask those questions. I know that many women have gotten pregnant, have gotten COVID, and are fearful about what will happen or not accessing healthcare. And so I think it's super important for us to really be able to answer this question. And thank you, Dr. Jen, for your leadership to be able to bring this to light, because I think it's one of the most common questions that we get. And it's often because of misinformation or disinformation. So, it's okay for us to have these questions, but before you share that information online, it's making sure that who is saying this and can you trust them? What is the evidence? Do the trustworthy sources, back them up? Those are critical questions in addition to finding out, and getting the care that you need.
Heidi, how do you think the Ad Council is targeting, I hate to use the word targeting, but addressing the concerns of pregnant women and the people who care about pregnant women?
Yeah, I think, first of all, I would put 5 exclamation points on everything Rita just said. And it starts where we started off this conversation about having respect, empathy, and understanding. So all of our messaging is really geared towards providing people with information from trusted voices. So I think if anybody out there is confronting a conversation, with someone who has these concerns, it's really important to not dismiss it and not to point fingers or to vilify someone for feeling a certain way, because people are scared. So it's pointing people to the right resources from the most trusted voices, and of course, first and foremost, healthcare providers.
And Dr. Kottkamp, what about what you can say just clinically about this vulnerable population?
Absolutely. This population is extremely vulnerable. We have 2 people, right? So it's taking the vaccine is an act of love, not only for you, your family, but also for your baby. And I think we have enough evidence that supports the safety of these vaccines. From the biological standpoint, the vaccine doesn't really reach the place where genes are stored. So if this vaccine doesn't get there, then there is no a biological explanation why a vaccine will modify, say, a genetic material. So it is important to understand also the biology of this. The vaccine goes to a very different place where the genes are stored, and therefore there is no messing up with genes. And therefore your baby and you are going to be protected. That's the best gift that you can give to your baby.
And Dr. Minguez, in terms of newborns, and to circle it back to vaccines and really the central topic of this town hall that we're doing right now, even eventually when there is an authorized or approved vaccine for babies, it will start at 6 months of age. So speak about that vulnerable time period in the neonate between birth and 6 months, where there could be and needs to be some degree of protection that the pregnant woman can pass along to that neonate or newborn from having been vaccinated herself.
Absolutely, absolutely. And one thing that I want to message, go back to a little bit is the messaging. Important to really describe the medical and scientific component. And there's great data, right, for the recommendation. We also have to listen to the parent, because they usually, that component, they understand and hear. It's the component of fear that they're very worried about. And we need to really talk about that and tease it out. It's more of the emotional component. And now going back to, of course, that period that you mentioned from 0 to 6 months, it is important for them to understand how they can be protected to their child, definitely. And that goes along with other different diseases as well. And it's being careful, but also providing them with any tools that we have available in the medical field to protect them even further.
I want to bring in a question. We got a great question from Erin in Texas, who, my arms have gotten shorter, so forgive me, I need my glasses. I have RA and I'm on 2 immune suppressant drugs. This is such a common question from people with autoimmune conditions. I just received the 3rd dose of the vaccine a few weeks ago. Can I finally feel free to do some more social things, such as go to small parties, eat out, or do I still need to take extra precaution? And does the same go for my family? Who wants to take that?
Sure, I'll take that. So, oh, sorry.
No, go ahead, Dr. Kottkamp.
So Aaron, congratulations on getting your 3rd dose. That was the right move. Definitely for people like you that are taking immunosuppressive medications, this is a clear recommendation with solid evidence. So congratulations on that. Now about the other measurements, we all need to continue doing that while we have this high tide of Delta. So this is not really the time to relax public health measurements. We still are are under risk of getting infected. And so until the wave goes away and we get to very low rates, then that will be an okay moment to relax measurements. For now, keep using your mask, limit your social gathering, and make sure people are also using masks and trying to stay 6 feet away and all these other public health measurements.
Excellent advice. And Mara, go ahead. I cut you off there.
No. My apologies. And just echo Dr. Conkamp. Definitely, I would mention to everyone, just really stay close to the CDC guidelines. Their recommendations are gold standard, and definitely continue to keep looking through that. And like it was mentioned, it is great that you got the vaccine. It is just important to see what the data is out there, and Delta variant is still of great concern. So we still want to continue to protect you.
And, as we wrap up, I want to also offer to our viewers who are watching right now, something that I think is really important just to navigate this whiplash and the ever-changing science and headlines that we're getting on these vaccines. No vaccine in medicine is 100% effective. Really, the endpoints for the clinical trials were to save lives and help reduce the risk of hospitalization. And then, of course, we want to see and hope to see vaccines that reduce the risk of transmission, that lower severity if we are to get infected. But I think we have to remember that there is no 100% holy grail that's perfect in the world of vaccines, but that it is the best tool in our toolbox right now. And then in terms of assessing risk as we get into the fall and holidays and school, it really comes down to 6 elements: time, place, people, space, whether masks are used, and whether people or you are vaccinated. So as we've heard from our physician panelists, to stratify your own risks in places outdoors, safer than indoors, masks, safer than unmasked, distance between people, more greater than less in terms of protection, and then density, how crowded the area is and how many of those people are vaccinated. And until we can get more of our population protected with the vaccine, I think everyone would find it useful to keep those factors in mind. And we will certainly stay on top of the ever-changing headlines because they are definitely coming at us at a fast and furious pace. But I really want to thank everyone for watching today and for submitting your questions to us at ABC News. We will continue to answer them and try the best we can to bring together great panelists like we did today. So Rita Carrion, Dr. Mara Minguez, Heidi Arthur, and Dr. Angelica Kottkamp, thank you so much for joining me. And of course to Dr. Anthony Fauci. And thank you all for taking time of your busy day to join us today here at ABC News. I'm Dr. Jennifer Ashton, ABC News Chief Medical Correspondent. Thanks again. Stay safe and stay healthy.
Thank you.
Thank you.